Hello everyone, and today's topic is haematopoiesis and composition of blood. Haematopoiesis is a blood cell production. Body continually make new blood cells to replace old blood cells. So you have to steady blood supply. Hematopoiesis start before birth and continue as a cycle throughout the life. It's easier to remember what hematopoiesis is when you consider its root. Hematopoiesis is derived from the Greek word hema means blood and poiesis to make something. What blood cells get made during the hematopoiesis? Blood cells are the building blocks of your blood, and hematopoiesis include the production of all blood cells type, including RBCs, WBCs, granulocyte, neutrophils, basophils, eosinophils, such as. Next is a composition of blood. So, what is blood? Blood is a main circulating fluid in the human body. Study of blood is called as hematology. It is fluid connective tissue derived from the mesoderm, bright red in color, slightly alkaline, salty and heavier than water. The adult has a slit of blood which constitute about 8% of total body weight. Blood is divided into two constituent: cellular composition and non-cellular composition. Then cellular composition made up of blood corpuscles, and non-cellular contains plasma. Blood corpuscles have three types: RBC, WBC, and platelets. In that, there are again two types of WBCs: granulocytes and agranulocytes. In granulocytes, neutrophils, eosinophils, and basophils are present, and granulocytes in mid monocyte and lymphocytes are present. And cellular compositions in that RBC, WBCs, and platelets. What is erythrocytes or RBC? Erythrocytes, also called as red blood cells, they are circular biconcave nucleated cells. Its size 7 micron meter in diameter to 2.5 micron meter in thickness. There are about 5.8 to 5.8 million RBCs per cubic mm in adult male. In adult female, it is about 4.3 to 5.2 million. Average lifespan of RBCs are 120 days. WBCs again divided into granulocytes and agranulocytes. Granulocytes divided three types: neutrophils, eosinophils, and basophils. And agranulocytes divided into two: monocytes and lymphocytes. What is leukocytes? Leukocytes are also known as WBCs. It is white blood corpuscles. They are colorless, nucleated, amoeboid, and phagocytic cells. Due to amoeboid movement, they squeeze out of blood capillaries. This is called as diapedesis. It is size 8 to 15 micron meter. They are about 5,000 to 9,000 WBCs per cubic mm. The average lifespan of WBCs are 3 to 4 days. Sorry. Next is leukocytes are divided into types on the basis of presence of granules, that is granulocytes and agranulocytes. First, we will see the granulocytes. In that, neutrophils, cytoplasmic granules are stained with neutral dyes. Nucleus is 3.3 to 5 lobed, hence called as polymorphonuclear. Consists of 54 to 62% of total WBC. Function of neutrophils are phagocytic and engulf microorganism. Then next is eosinophils are cytoplasmic granules which are stained with acidic dyes such as eosin. Nucleus is bilobed, consists 3% of total WBCs. Function is they are non-phagocytic and increase during allergic reaction. They show antihistamine property. Increase in number of eosinophils is called eosinophilia. Basophils are cytoplasmic granules that stained with the basic dyes such as methylene blue. Twisted nucleus, and they consist of 0.5% of total WBCs. Functions are they are non-phagocytic. They release heparin as anticoagulant and histamine also. Next is granulocytes. In that, lymphocytes are large round nucleus, consist of consist about 25 to 33% of WBC's. Function is it produces antibodies and responsible for immune response of the body. And then next is the monocytes, largest of all WBCs. It and kidney shaped nucleus. It consists of 3 to 9% of WBCs. Functions are they are phagocytic in function, so they can as a scavenger. Then next is platelets. These are small fragment of bone marrow cells and therefore not really classified as cells themselves. Function is secrete vasoconstriction from temporary platelets plug to stop bleeding, secrete procoagulant to promote the blood clotting, dissolve blood clot, digest the destroy bacteria, secrete some chemicals to attract neutrophils and monocyte to the site of inflammation, secrete growth factor to maintain the lining of the blood vessels. Next is the plasma. It is a straw colored, slightly alkaline viscous fluid. It contains 92% of water, 10% of solute, and 7% of protein. Plasma proteins such as serum albumin, serum globulin, heparin, fibrinogen, and prothrombin as a coagulating factor in the inactive form. Then other nutrients such as glucose, amino acid,